What's up, y'all? This is Carolina Doc PT, and in today's video we're going to be going a little bit deeper into the topic from my last video, which was how you need to be using your walker if you have been told that you need to do so. And in that video we talked about people that are post-surgical using assisted devices, and so I wanted to go into that in a little bit more detail. I also have received some questions on some previous videos that I did related to walker use and when you should be using that walker and dropping from the walker to a cane or the walking to nothing at all. So I wanted to go into that in a little bit more detail here. So if you are post-surgical for a knee replacement or a hip replacement, really and truly the prescription is about the same for both. You're going to be using those walkers for about 2 to 3 weeks. That is assuming a couple of things. And so let me address the knee replacement. For knee replacements, yes, that is pretty well going to be the case. That is assuming that your balance is going well, or your progression with your balance is going well. That also is assuming that your surgeon did not have any other stipulations for you. Sometimes surgeons, for whatever reason, may want you to stay with a two-handed assisted device for a little bit longer period of time. But most surgeons are okay with physical therapists. Usually it's going to be your home health physical therapist advancing you from your cane to from your walker to a cane. As your knee is able to flex more and you're able to get a little bit better footfall and towing off on that surgical side, then it becomes more appropriate to advance you from using a two-hand assisted device down to using a one-hand assisted device. And so that can happen in that 2 to 3 week range. Is you're kind of making that transition from using a walker. You certainly will be using a walker for about the first 7 days. Now I had one comment from an individual who was talking about, well, they were able to get rid of their assisted devices totally by day 7, and I just I mean, that's great. Everybody is going to come into a surgery or come out of a surgery having had, a different history in their background. If you're somebody who's really, really fit, and then you had your knee replacement, yeah, you may advance a little quicker than your average person is going to do so. And hey, that's awesome. Good for you. But that's not to say that everyone else or all the rest of us will fall into that same range. Most people are not going to do that. And most people within the first 7 days for sure are going to need to be using their two-hand assisted device, not just to prevent falling, but also to prevent that knee from overworking and from getting just having too much exertion. If you advance too quickly, a lot of times you're asking for more pain, and you're not going to get yourself, like, recovering from a knee surgery. It's almost like birthing a baby. It takes a little bit of time. You're not going to do a whole lot to necessarily significantly speed it up. I mean, there are the random cases, of course, of people that, hey, they miraculously are walking and they felt back to normal really, really quick, with great range of motion and good strength and all that. Yes, those do happen, but it's not the norm. It's not what everyone should expect. Your expectation needs to be at about week 2 to 3, somewhere in there. You're going to be progressing on from your walker to a cane. I will say, when you return to your surgeon's office to do that follow-up visit, absolutely return with your assisted device, whichever it is at the time, whether it's the walker or the cane, whichever one the physical therapist has progressed you on. It's not wrong to return with your walker. It's not wrong to be coming to that 2 to 3 week follow-up visit on a walker. So you shouldn't, feel bad if you're not at a walker, but if you're able to advance to a cane, that's usually is what I would recommend and would want for a patient. But I would absolutely not want you to return without using that assistive device. That's one thing I've always told patients. Look, if you're just wanting to get yelled at, you return to your surgeon after a knee surgery or a hip surgery for that matter, but return to your surgeon, and you will get a really good talking to, because they know how you should look, and they know what they're expecting to see, and that is assisted device use when you come back to their first visit. So knee replacement, that's about what you're expecting, and then you're going to be using that cane and then progressing from the cane to nothing at all over the next probably 2 to 3 weeks after that point. That cane use, that's the thing that might go quickly for some people, or a little quicker for some people than others. So that is one of the things. Pretty much everybody's going to be using that walker for around that first 2 weeks, and 2 to 3 weeks, as I say, and then you'll progress to the cane. But some people may progress a little faster on that cane. That's going to depend on a lot of factors that your PT will work with you on. Everything from how your balance is going, how your strength is going, how well you're recovering from the surgery, where there are complications, etc. So that's all on the knee replacement side. For you folks that have had a hip replacement, okay, for you it might be a little bit different. Again, looking at least about 2 to 3 weeks. However, sometimes after you've had a hip surgery or after you've had a hip replacement, you may have some additional weight-bearing precautions, kind of depending on what was done, kind of depending on how the surgery actually went. So there's a chance that you might be on a walker, going out 4 to 6 weeks for that kind of a thing. I would say generally, again, the rule of thumb would be 2 to 3 weeks. Now, the exception to that is coming back to the surgeons. Some surgeons for hip replacements, some of the ones that we work with in my area, they do not want PTs advancing their patients within the first 3 weeks of having had a hip replacement from utilizing their walker. So for those types of patients, it very well may be, or for the patients of those types of surgeons, you very well may be on a walker till 3 weeks, which is they may tell you, hey, walker use until you return to see them in the office, and then at that point, then you're able to advance and go from a walker to a cane. But as I say, if you had any other sort of complications within your surgery, then you may not progress that fast. As long as you have any sort of weight-bearing precaution, you're going to be using a walker. Once your weight-bearing is tolerated, now that's the point where you're able to kind of progress on to a cane, again, assuming that your balance is going well, that your strength is progressing, and that no other difficulties are happening with your surgery. I would say once you're on that cane, then you're again looking in that same kind of 4 to 6 week range. And again, same as I said with the knee surgery. Hip replacements, if you came into that hip surgery and you were a very fit individual, you have exercised all your life, your balance is really good, then yes, you're going to progress faster than the norm will. And there's a chance you might move along in that a little quicker. Although, if the surgeon has given you that precaution, any precautions on weight bearing or restrictions on weight bearing, or if the surgeon has just flat out said you're using a walker for 3 weeks, highly recommend that you follow that surgeon's advice. They know what they are expecting to see from their patients after they've done these hip replacements. They know the product that they're working with as far as the type of device that they're installing, and they know what the expectations are. It's, again, kind of like birthing a baby. You're not going to progress things too much faster than what I'm telling you. So in that 2 to 3 week range is what you're going to want to be kind of working on and thinking about, and then looking to go from that walker to a cane. And yes, one other thing, and another question that we often get, you will be, if you don't have a cane and you've come out of the surgery, you are going to want to get one. So you're not going to want to go or you're not, would be completely wrong for you to progress from using a walker in that first week to nothing at all. Okay, it's too big of a jump to go from walker to nothing after having had a surgery such as a knee replacement or a hip replacement. You have to have a kind of a midpoint. It's too big of a jump. You need a little lily pad to land on as you're dropping across that or jumping across that river. So the cane is what you're going to expect to use. So you'll expect to go walker, cane, then nothing. That is the progression that you're expected to follow when advancing your with your walking and with your weight bearing and with your assistive device use. Okay, so do have that and have that kind of expectation set for you in your mind, so that way you're not looking to advance yourself too quickly. People that advance too quickly are going to oftentimes have more pain and take longer to recover. And if they overstress those areas of the surgical replacement, so you don't want to do that. Definitely follow your physical therapist's advice and what he or she is trying to progress you, or the time frame they're trying to progress you within. Definitely follow what the surgeon is telling you, and they should keep you progressing along in a good direction. So I hope that's clarified things a little bit more and explained a little bit more as to or helped to set your expectations a little bit more as to what you should be experiencing as far as walking with an assistive device after your surgery. So good luck to you, and I'll attach the video that I was talking about earlier that addresses just people utilizing their walkers, and you can take a look at that as well. All right, I hope you all have a good one.